Welcome, UPSC aspirants, to another critical explainer from Rungta IAS Academy. Today, we're diving deep into a topic that is absolutely non-negotiable for your General Studies Paper 2 preparation. We are decoding the latest national health accounts data. Now, if you're aiming for those top marks in mains, these are the foundational metrics you simply have to master. Let's get right into it.
Here is our quick roadmap for today's explainer. First, we'll look at the core GS2 focus on the NHA data. Second, we're decoding out-of-pocket expenditure. Third, we'll compare public versus private insurance. And finally, we'll tackle privatization and preventative care.
All right, starting with our first crucial area, the GS2. Focus on the actual NHA data.
Now, look at the contrast right here. The government highlights that government health expenditure has actually risen to 1.48% of the GDP. Sounds like progress, right? But as future administrators, you need to critically analyze this against our established benchmarks. The World Health Organization targets 5%, and our own national health policy targets 2.5%. The key takeaway for your mains answers here, we are still falling significantly short of those universal health coverage targets.
You also really need to notice the internal dynamics, especially this post-COVID drop. Government spending as a share of current health expenditure actually fell from 41.1% down to 35.6% in the 2022-23 period. So that pandemic-era boost, it just wasn't sustained. Plus, remember that health is fundamentally a state subject in India. State governments shoulder over 63% of this expenditure, while the union government contributes roughly 36%.
Let's move on to our second critical theme, decoding out-of-pocket expenditure. 49.90%. I want you to just take a moment to really absorb that figure. Out-of-pocket expenditure accounts for practically half of all health spending in India. That is money coming straight out of the common citizen's pocket, right at the point of care. When you are discussing healthcare equity in your exams, this is a massive, absolutely crucial point to raise.
Next up, Section 3, where we'll unpack public versus private insurance.
The disparity we see here is quite stark. Total expenditure under government-financed health insurance schemes is roughly 26,266 crore rupees, and that represents a mere 3% of India's total health expenditure. In sharp contrast to that, private health insurance expenditures, largely paid by households, stand at 9.2%. That means the reliance on the private sector is 3 times higher. Now, to ensure your answers have true analytical depth, it's always good to bring in expert critiques. For instance, Dr. Abhay Shukla from the Jan Swasthya Abhiyan points out that schemes like the Pradhan Mantri Jan Arogya Yojana, or PMJAY, are, and I quote, failing to provide substantial protection to people from high healthcare spending. Quoting balanced critical views like this shows the examiner you understand the ground realities. This brings us to our final core theme, privatization and preventive care. What we're witnessing is deep, structural privatization in India's health system. Private hospitals consume the absolute largest share of current health expenditure at nearly 31%. Compare that to government hospitals, which sit at just under 17%. This kind of unregulated privatization really deepens inequalities in access, and of course, it drives up costs for the common man. Finally, we have to look at this very sobering reality. Preventive care forms only 8.88% of the current health spending. Given India's massive growing burden of non-communicable diseases, things like diabetes and hypertension, this is a glaring structural flaw. In your GS2 paper, you must argue forcefully that India urgently needs to shift from a purely curative model to a robust, preventative approach. To wrap up this explainer, we want to leave you with a capstone question to think about for your UPSC personality test. How exactly do we reconcile the narrative of rising government health expenditure with this persistent 50% out-of-pocket burden on our citizens? Take some time to synthesize this data, formulate your own analytical stance, and keep studying hard. Thank you for joining us here at Rungta IAS Academy.